Yeah, well, there's still really a pressing need in optimizing the secondary prevention after stroke. The recurrence rates after stroke are still alarmingly high, and we do not really have appropriate measures as per now to hand to really tackle this disease. So inflammation is really a cornerstone in the pathophysiology of stroke. So there's a broad body of evidence showing that inflammation really occurs after a stroke, that we got like a very urgent release of cytokines and leukocytes released to the circulation, followed by an immunodepressant phase, and then a really chronic phase where we have an enlargement of distinct cytokines and DAMs in the long term even. And we also know there's also a pre-inflammatory phase occurring before the stroke, leading to clot formation via immunothrombosis, for example, but also activation of atherosclerotic plaques. And on the other hand, we also have an inflammatory response after stroke that is all activating these mechanisms. So actually there could be novel targets to really tackle the disease burden of recurrent events by addressing actually these mediators that could be then reducing the overall occurrence of recurrent events. For example, cell-free DNA. Cell-free DNA is a DAMP, it's a damage-associated molecular pattern, and this is released during stroke, not only by dying brain cells, but also by neutrophil extracellular traps. And we know that this cell-free DNA is really pro-inflammatory, but also pro-thrombotic. And shown in the translational work, the reduction of cell-free DNA by DNase could really also provide a really reduction of recurrent events in that manner. So that could be really an application in this regard.